Good morning and welcome to SonoSim's first hosted webinar focusing on an in-depth review of the newest content we've developed specifically for DMS program instructors and students. Our team of expert sonographers will demonstrate several DMS protocol cases and review our DMS innovation roadmap for this year. All attendees will be in listen-only mode and may ask our panelists questions during and after the session in real time through the webinar chat. A recorded version of this webinar will be available after our session. If you're just joining us, welcome. At this point, I'll introduce Dr. Eric Savitsky, Professor of Emergency Medicine and Pediatric Emergency Medicine at the University of California, Los Angeles. As the founder and CEO of SonoSim, Dr. Savitsky is a pioneer in ultrasound education. Welcome, Dr. Savitsky.
Great, thanks Heidi. It's a pleasure being with everyone this morning virtually. Wanted to just take a few minutes prior to introducing our esteemed panel of sonographers and our liaison to the DMS community, but wanted to just spend a few minutes just reflecting a little bit on the past year, a little bit on SonoSim's mission and how we really have appreciated working with sonography programs over the last year, and how we're hoping to build on that process going forward. So a little bit, folks who are attending today, it's a mix of potential folks who are not have not worked with SonoSim before and existing clients, and as Heidi mentioned, the focus is going to be really digging into existing products that many of you have, but just taking a step back and reflecting a little bit on SonoSim's mission. So SonoSim was established and is dedicated to improving and transforming medical care by serving as a global leader in ultrasound education and training. And how we typically work is we work with other institutions. SonoSim came about over a period of about 20-25 years, where initially I had started a nonprofit with a lot of the folks who are currently involved with SonoSim. And then we wound up doing taking a lot of those educational advances, working with the Department of Defense during the wars in Iraq and Afghanistan to train our military care providers on the care of host nationals, as well as U.S. service members. So a lot of this technology evolved over 15 to 20 years and eventually transitions to SonoSim. There's been a very, very common theme throughout all of those journeys. When we worked with relief organizations, it was working with experts in the field, really understanding who they're educating, what the challenges they're running up against, the processes that we currently have. And then we would work with subject matter experts who are leaders in their field to really create customized education. And the key during this whole journey going into how we're working with the sonography community and the genesis and motivation for being with you here today is to really engage you in a dialogue and make sure you feel very comfortable communicating with us at SonoSim, whether it's through your territory manager, through member success, or just email or calling us. We definitely want to hear from you. And the way we have worked and achieved success, and success is helping over 1,300 institutions around the world, helping our partners, which is you, educate over 60,000 learners, ultrasound learners over the last several years, and working with global partners in 40 countries around the world. So the way we work is by really understanding your needs as educators and providing you the tools and the services you need to really ultimately be effective. So at the core basis of what we do, we've heavily focused on what are the elements of ultrasound competency, and then how can we really provide them. And as you well appreciate, knowing the indications for an exam, understanding the knobology and how the equipment works, how to optimize your images, how to perform a systematic examination, which is critically important. One of the biggest differences in what we're highlighting today we initially started in a point of care environment, and we have transitioned and become much more specialized and really, really focused over the last year and going into this year of customizing to sonography needs and sonography program needs. And that's it's highlighted in the real importance of a systematic examination, and that underscores a lot of the protocols that we'll be evaluating and reviewing with you today. Understanding how to interpret images, documentation of the examination, and medical decision making. And this last point on medical decision making, I think, is really critically important. Many of the changes that you see happening in healthcare right now, whether they were pandemic driven or technology driven, AI advances, it really underscores the importance of making sure our sonographers, our ultrasound users really understand the medical decision making. And one of the things in terms of how SonoSim is constructed is to really underscore the importance of when you have a finding, knowing the relevance, having the confidence to, even though the physician ordered maybe a rule out appendicitis ultrasound, but when you're actually there, you actually potentially see something in the ovaries or the adnexa. So having the confidence to, reach out to the physician and suggest maybe a transvaginal ultrasound exam. Or when you do an examination and you do see an ectopic and you also see, a large amount of free fluid, that's not obviously an interpretation that goes and gets registered and someone hears about it when they hear about it. That's actually picking up the phone and calling the ordering care provider so they know about the acuity and the clinical significance of the finding. Having worked with sonographers over the last 20 to 25 years, the critical nature that sonographers play, and then the medical decision making. When you think of technology advances, AI advances, they're very narrow verticals. And at the end of the day, applications of artificial intelligence will be applied very narrowly, but being able to think across silos and not only be able to acquire an image and interpret an image, but actually know what to do with that information. All of those things are going to be what continue to differentiate humans from machines. So that's something that SonoSim is really heavily focused upon. So, as you well kind of appreciate, these are the challenges. So these are the issues when I was trying to train my fellow physicians, 15 years ago, in about 3 weeks, realized, wow, there's got to be a better way. And was fortunate enough to work with a lot of talented people and provide a lot of the tools that we're talking about today. But, if you want to teach someone ultrasound in a really effective way, you obviously need a machine, a qualified instructor, and a student, a patient with pathology, which is the most critical piece in some ways, a teaching moment. So all of those things coming together, and then needing to have all of those things come together until someone actually achieves mastery. And then you need assessment resources. So when you're trying to assess whether someone knows and can recognize a condition and do the exam, you actually need all of those elements together once again. And then you need the refresher training. How often do you need refresher training or a just-in-time reference guide so you can avoid skill decay? So all of those things have been historical barriers and have been what's been very challenging for all of us as we try to teach and get ultrasound learners up to high levels of competency. So all of those things that I laid out in some ways underscore all the elements of what we try to provide with SonoSim. So SonoSim's offerings are courses made by leading experts in their respective fields, all peer-reviewed, typically come with between 3 to 5 hours of CME. That's accredited and recognized by AIUM as well as ARDMS. The other key piece that we've developed over the last 2 years and we fully transitioned is all of our courses are mobile optimized. And this ties into a little bit of the newer generation of learner, right? So all of you are, most of your students are 20, 25, 25, 30, some later mid-career people, but so many of them are young learners, and just the way they learn and society and how it's evolved, they want to learn off of mobile platforms. So everything that's created that's a course is mobile optimized. So there's 3 elements to that. There's a bedside reference. So if you're at the bedside and you're trying to remember, oh my gosh, what was the endometrial echo complex maximal width for someone 50 and above, having that quick reference guide at the bedside. There's key concepts, which take the courses and minimize them to the key concepts, but simplify it. And then there's the courses themselves that are fully mobile optimized and functionally can be viewed through an iPhone or Android device. The second component, as you can see here, is holding a probe in your hand that has motion sensing technology. And assuming you select the correct image window, the exact hand movements within that image window teach you that image interpretation and image acquisition skill. That's the SonoSimulator. Some of the advances we're going to discuss a little bit later today. SonoSim Performance Tracker lets you manage all of your learners, provide feedback, see how people progress on the declarative knowledge aspects. The automated assessment with AI, there'll be multiple iterations. The first version that we'll be rolling out in the next several weeks is really focused on, did someone acquire the right image and did they get an image view that is deemed acceptable? And it will be graded as acceptable, unacceptable, or indeterminate. And we'll subsequently be adding gain, depth, and then ultimately adding medical decision making. What did they do with that information? And there'll be some questions that can get posed, and all of this is assessed in an automated way. So it really creates some efficiency. for system administrators. SonoSim LiveScan with Case Builder, that's a tool that essentially you put SonoSim tags that are RFID enabled on a person or a mannequin. You can create millions of case scenarios using Case Builder. And you can really see, can your sonographers not only acquire an image, interpret an image, but decide what they actually should do with that information in terms of recognizing its significance and what the next potential steps are. And then ultrasound guided procedure training, we have a wide variety of it. You'll see some of the MSK modules today. And the key, appreciating that sonographers aren't necessarily the ones doing the procedures, but really understanding that regional anatomy, understanding the indications, and really digging into a particular joint just helps on the image recognition, image acquisition, and fully appreciate that many times sonographers are, they're basically first in line for marking and putting an X, on a spot where clinicians basically are going to use that marker to do whether it's a paracentesis or other image-guided procedure. So the last piece I'll leave you with, this to me is in some ways is the most exciting and most critical aspect of what we do is, we have a very rich content library. What you see here is just an example of our neonatal neurosonography module that was released. So you have premature infants anywhere from 24-week preemies up through post-term. But at the end of the day, it's our ability to scan real patients from a variety of different institutions, whether they're neonates, premature neonates, or complicated third trimester pregnancies, or trauma patients or patients with cardiac conditions. So it's our ability to capture real data and basically process it, use our techniques to actually put it into a virtual environment, and then ultimately provide it to you to educate and to help educate and train your learners. So really excited about that, and the content library is something that can be applicable across all the years of training, and as well potentially for continuing education of sonographers. So very excited to highlight that as something that we're committed to continuing to develop and provide for you guys. Wonderful. So this is my time to exit. I actually have a shift a little bit later. I'll come back to say bye, but so excited to introduce Deb Tracy. Deb is someone, and if you saw earlier, one of our strategic partners is GE, and we've worked very closely with them. I've known Deb for we won't date ourselves, but for many years. I've always loved interacting with Deb, and the biggest thing that drew me to her, outside of her great affability and demeanor, is just her passion about ultrasound. It's so easy when you meet someone and you can tell they drank from the same Kool-Aid, which is the enthusiasm of how ultrasound can really impact patients' lives. And if you've drunk from the Kool-Aid, you recognize it in other people. And I was so happy when Deb, decided to move to the next adventure after her GE life. It was it took me all of about 3 seconds to I don't think she was home yet, and I was already pinging her. And then we couldn't have a better person from a SonoSim perspective as serving as our liaison to the DMS community. So Deb, I'll let her tell a little bit about herself, but Deb's role from my perspective is to serve as that liaison between our sonographers, our production team, and you as the DMS community to really start to develop that relationship, that dialogue. The better we understand, the faster we understand what you need to be successful, the quicker we can develop it. And with that, I'm going to turn it over to you, Deb. Take it away.
Thanks, Eric. Good morning, everyone. I am Deb Tracy, and I have been a sonographer, let's just say many years, but I did spend the first half of my career as a sonographer and a DMS clinical instructor. And then I moved over to the commercial side, and I worked in many roles throughout the 25 years. But education has always been my passion. And I just really enjoy working with students and seeing their faces light up when they have those aha moments. And, then moving into being the DMS program advisor with SonoSim, it just became something that part of what I love. And to this day, I've got to say that ultrasound has been truly a great profession for me, and I continue to stay engaged in it. So anyways, let me share with you about today's agenda. I'm going to introduce to you our panel of experts, and they will share portions of our new launches on pre-dialysis mapping and GYN protocols and the upper vascular cerebral protocols and arterial, venous, and everything. And then I get to share with you the roadmap for the DMS roadmap in particular. And it's just great, and it really just shows you how interested and how dedicated we are into really getting things moving. Okay, so, sonographers are the storytellers. We're the eyes for the physician, and we are the investigators to help patients. We work with the sonographer, with the radiologist, and any of our leading interpreters, but it's so critical to always be sure that what we're doing is complete and comprehensive, and we're delivering that information to those interpreting physicians. The sonographer has to provide a complete exam that corresponds to what the patient history is. We have to thoroughly interrogate all the organs and making sure that we annotate it correctly and measure it correctly, and that we yield this information back to the interpreting physician. We're committed to providing a training solution that's specific to the DMS program, always keeping in mind the program director's needs, the instructor's needs, and of course the student's needs. Our goal is to provide a strong foundation for learning and always be confident in knowing that all of our protocols will align with the AIUM, ASE, and KHAB practice guidelines and standards. We'll continue to enhance our programs while developing new courses to deliver the best training experience possible. Now I'd like to introduce to you our panel of experts. Our contributors are part of our team. They ensure accuracy in both scanning protocols and techniques, provide SonoSim with clinical images, and are global ultrasound community members. Today we have with us Teresa Whitney Ray, our Senior Ultrasound Technologist in Education and Production Manager, Chris Cato, Ultrasound Education Production Manager, and Melissa Kang, Ultrasound Education and Production Manager. So now I'd like to turn it over to Teresa.
Hello, thank you, Deb, and thank you all so much for being here. My name is Teresa, and I've been scanning for 22 years. I am a Senior Educator Production Manager, and I've been working to create our OBGYN content. For the last 6 years, we've been working with members from AIUM to create our OBGYN courses and cases. We realized we needed to create DMS-specific protocols to support sonography programs and also our fellow sonographers. We created focused protocol assignments for our GYN pelvic examination following AIUM practice parameters. So if we look at that, here we go. This is AIUM practice parameter for the performance of an ultrasound examination of the female pelvis. You'll see detailed step-by-step instructions on what it means to obtain how to take measurements, where to take measurements, how do you place your caliper. All of that is listed here for you. So let's look at our DMS protocol assignments. Let's look at what they look like, see how we've created them to match AIUM protocol. For GYN, we created a comprehensive protocol, uterus protocol, Adnexa ovaries, and Adnexa fallopian tubes. All of these highlighting different things. Fallopian tubes, of course, looking at abscesses or hydrosalpinx. Ovaries looking at what is normal, what is abnormal, what is benign, what is suspicious, ovarian torsion. Uterus protocols looking at the differences in the layers as it goes through cyclical changes. What is normal, what is abnormal. And then in the comprehensive, we brought all of these pieces together, and it would be your comprehensive protocol like you would perform in the field. It's a lot at first, which is why we broke it up into segments. But let's say, hey, let's take a look at the ovaries. If you look at our DMS GYN Adnexa ovaries protocol assignment, you'll see we say what case to go to, what window to go to, right Adnexa. We tell you what to evaluate. We tell you what to measure. We tell you how to measure it. We tell you evaluate the right ovary with Doppler. We tell you to measure the width and height of any identified abnormalities. You're going to do the same thing transabdominally that you do transvaginally. So when we go to the simulator, here we are, DMS GYN Adnexa ovaries protocol case 1. We're in the transvaginal plane, and you can see our ovary here. And we are evaluating with color Doppler. So we could save this image, turn it into our instructor, and step-by-step go through our protocols. So this is what this does. It allows the user to practice all the parameters without putting the patient at risk or making a patient feel uncomfortable, and giving the user the confidence in the protocols themselves, but also in their ability to perform them. So that's what we're doing for our GYN protocol assignments. I'd like to pass it on to my colleague, Melissa, who's going to talk about our DMS vascular protocols. Thanks, y'all.
Hello, my name is Melissa, and I've been an ultrasound technologist for about 15 years. I've worked in multiple settings, which includes hospitals, outpatient imaging centers, and physicians' offices. And one takeaway from working in all these settings is that if you know your basics, which includes basic protocols or your basic windows, you're already ahead of the game. And that's what makes these DMS protocols so exciting. As we did for the GYN protocols, we have created the basic imaging protocols using AIUM guidelines, which each student will have to learn and master as part of their training and eventually perform in a professional setting. Knowing protocols and the windows we need to image will take away some of the stress when you're in your first scanning site or scanning your first patient. I remember when I went to school, we only scanned specific windows or a couple areas, never a whole protocol, and so going to the real world was an eye-opener. I would think, how long is an exam taking? But in reality, I just wasn't used to the repetition of going through a complete protocol or knowing my basic windows. As you see in the sauna simulator, we have included complete bilateral exams, which incorporate grayscale, color Doppler, pulse wave Doppler with proper angle placement and compression. The DMS protocol assignments guides the users through each aspect of the protocol in a standardized fashion. As the user works their way through the imaging protocols, they have the benefits of a sauna simulator training features if they need guidance to the optimal windows or need an instructor to guide them through the images they see on the screen. By the end of this assignment, you will get a sense of how long performing a complete exam can actually take. DMS protocols pair well with anatomy and physiology vascular modules such as arm venous, arm arterial, and cerebrovascular. The anatomy and physiology module content covers the fundamentals of vascular anatomy and imaging. The DMS protocols expand on learning and expand on the windows needed to provide learners with the opportunity to scan complete comprehensive exams. Our goal is to provide students a head start and more confidence as they start going to the real world. With going through these protocols and with repetitive motions, they will be ahead of the game. And with that, let me introduce Chris.
Hi, my name is Chris Cato. I'm one of the sonographers here on staff. At SonoSim, we understand the enormous pressure DMS programs face in providing content and instruction during these difficult times. Given the current program time constraints and the sheer amount of information available to learn, we understand that online learning and simulation is a necessity. Now that the users have gone through the protocols mentioned earlier and familiarized themselves with basic anatomy, it's time to move to a more advanced lesson. We have created an advanced module for vascular mapping for preoperative planning of dialysis access. This is a very detailed introduction to pre-dialysis vascular mapping evaluation for AV fistulas and grafts. We combine curriculum and teaching tailored to vessel mapping used to build knowledge, practice psychomotor skills, and raise confidence levels. Advanced procedure modules consist of a course, scanning cases, and a module assignment. The course explores the use of ultrasound to survey upper extremity vascular and determine the most desirable hemodialysis access site for AV fistula or graft creation. Relevant anatomy of the upper extremity vasculature, imaging protocols, and various types of AV fistulae and grafts are discussed. The SonoSimulator helps develop psychomotor skills required for performing ultrasound vascular mapping of the upper extremities. The case structure is as follows. Cases 1 through 8 focus on a specific learning objective. Cases 9 and 10 combined consist of a complete study used to determine suitability sources for inclusion in future AV fistula and graft creation. In the interest of time, I'd like to give a quick peek into cases and sample assignments. Here we have case 1 in the SonoSimulator. It has 4 image windows focusing on the radial and ulnar arteries at the proximal and distal wrist. Here are examples of post-wave Doppler, color flow Doppler, and compression. Case 2 also has 4 image windows and focuses on the cephalic vein. At the wrist, in the antecubital fossa, in the mid-upper arm, and at the axillary vein. Compression and color Doppler are shown here. Cases 3 through 8 continue on in this manner. Cases 9 and 10 combined have 19 image windows incorporating all points from cases 1 through 8. This is a complete study based on ACR, AIUM, and SRU practice parameters. Module assignments consist of scanning-related tasks that by assignment end will incorporate all necessary elements to complete vessel mapping. In conclusion, we hear the voices in the DMS community and continue to provide a variety of content to help answer these calls. Thank you for your time, and back to you, Deb.
Thank you, Chris and Melissa and Teresa, for that information. It's certainly exciting to add those as a compliment. And now I get to show you guys the roadmap. So we've expanded our case library to provide your students with over 100 hours of scan time and to complement and reinforce your clinical scan labs with over 1,000 real patient cases to choose from. Our comprehensive protocols will provide a foundation for real life scanning experience. As we look back to Q3 of last year, you'll see we added a new neonatal and infant neurosonology module. We worked closely with our subject matter experts to develop this detailed and informative module. As Teresa noted, imaging the pelvis can be complicated, so we created step-by-step exams for each of the segments of the pelvis, including a complete GYN. In Q4 of last year, we completed the pre-dialysis vascular mapping that Chris just shared with you. We added the MSK procedure models, which are great for your students to review. They'll gain the knowledge of how the procedures are performed and be better prepared when they enter into the clinical setting. And whether they're assisting or observing, it's just a great way to reinforce their knowledge. You'll also have more access to pathology cases in OBGYN, such as renal calculus, hydronephrosis, and hypovolemia. And you just witnessed the demonstration of our new vascular protocols for upper extremities and the Cerebrovascular protocol as well. Now for Q1, for those of you with a cardiac interest, there'll be an introduction to TEE module and a cardiac assist device module. You'll find more musculoskeletal procedure models, including biceps tendon and acromioclavicular joint procedures. Plus, we'll add more OBGYN cases to the case bank. And we are finalizing our lower extremity venous, arterial, and abdominal vascular protocols. So I'm positive that these new protocols you will find are a great addition. Coming up in Q2, we will introduce to you the Echocardiography 3 model, which include chamber size assessment, ischemic heart disease, and diastolic dysfunction. As we develop this module, we will align with the ASE standards and practice guidelines. We also plan to add a pediatric pulmonary module and more MSK procedure models. And for our general imaging sonography section, we will be developing abdominal protocols that are specific to each organ, such as the liver, gallbladder, and kidneys, and so forth. And then our new assessment with AI will streamline the instructor's role in grading the students' image acquisition. And Dr. Savitsky will share additional information on the insights of AI. So for the future, as you can see, we have a strong commitment to expanding the DMS offerings. We will stay busy developing more protocols specific to the anatomical regions, including the heart, small parts, and additional abdominal protocols, finishing it off with a comprehensive abdominal protocol. All of these will be designed to mesh your students' clinical assignments. So in closing, we will continue to enhance our existing programs while developing new DMS training modules to integrate into your course objectives. Now, I'd like to turn it back over to Dr. Savitsky to provide more information about our product.
Great, thanks so much, Deb. So we'll close it out with this slide and then leave some minutes for Q&A. But just closing out a little bit, as we're emerging, thankfully, from the pandemic, and hopefully, the progress continues in that regard. We've been heavily focused on really supporting the programs through that challenging time, and then really thinking how to build in that, that flexibility, that resilience going forward that lets you be as effective as you can educating your ultrasound learners. Several of the advances that we've developed, just to make sure everyone's aware of them, we literally have well over 1,000 cases at this point, and millions of case combinations you can put together for training. The big challenge is having all of that information actually fit on one computer. Our total application install was getting over 30 gigabytes and just progressively growing as we add cases. So one of the changes that we made is the ability to download. So our content now is downloadable. You can do the initial installation through a thumb drive and get up and running, but subsequent modules, as they become available, your users can download them based on what you've assigned to them. They can delete them. So it allows just basically an economy of memory loading on people's systems. So this was a really important advance. What was technically very challenging, but that has been available, and we've received very positive feedback. So just making sure everyone's aware of that. The automated assessment, just a little word on that. So once again, we'll be reaching out to you, and we definitely want to hear from you in terms of what are the things that you want to have automated. So our vision is you can standardize, make sure everyone has a solid foundation, not just of knowledge and didactic and declarative knowledge, which they have now through the mastery test and performance tracker, but also on the image acquisition and moving into image interpretation and potentially decision making. So just making sure all of your users have a standard foundation, and you can really build and use that foundation to kind of fill in the gaps and really teach the finer and most critical pieces. And obviously, that final mile of sliding the transducer and all the techniques that you need at bedside to optimize your images, that is obviously all done live and in person. But the version 1 of the automated assessment, it's going to once again provide feedback: acceptable, unacceptable, indeterminate, of assuming you were given an image window, did you correctly achieve an optimal image view? And then version 2 and 3 will integrate gain depth, and then once again we can integrate medical decision making subsequently. The other tools that will be coming out in the other applications, we're going to be launching Sono Clips, which is the findings video. So it's the expert narrated 2-3 minute clips of what each of the cases represent, and those will be Sono Clips that will be released shortly. Challenge cases continue to go out, so just everyone is aware, our SonoSim content library continues to grow, and everybody has access to that through the challenge cases. And then we'll be launching, with your feedback, something called the SonoSim Case Bank, which is essentially, it's the way we have heard, today's learners want to learn, where they can load a case, be given a case history, tasked with answering a clinical question, or performing a ultrasound related task, and then they would be able to just case by case pick the topic and be given random cases to where they can apply their clinical skills, both the acquisition, interpretation, and potential medical decision making. So very excited to roll that out, but most importantly, just wanting to engage with the community. Member success at sonosim.com, or your local territory manager, or just feel free to call us at any point in time. Love to hear from you, love to engage in that dialogue, and please keep Deb busy and her ears filled so she can really continue to translate all of your needs to our development team and our expert group of sonographers that you met today.